Hello and welcome to the technique video for a 30-minute massage session for someone who has their breast implants removed. So this person may have just an explant and block capsulectomy, the implants removed and then stitched back up, or they may have their breast implants removed and then a breast lift, a mastopexy done as well. The majority of this massage is going to be manual lymphatic drainage. We are going to do manual lymphatic drainage to help reduce the swelling. We're not going to do any deep pressure massage at all in the breast area. They've just had a lot of surgery in that area. So as in the other videos, I always use a breast drape. The goal is to cover the client's nipples at all times and give them a breast drape, and then we can undrape the breast in sections so that we can get to all of the breast that we need to for the massage while keeping the client's nipples covered and the rest of the breast tissue covered. So we can go ahead and pull the breast drape down like this to get to the medial section of the breast, the superior section of the breast. We can fold the breast drape over to get to the lateral section of the breast, and then we can fold the breast drape up to get to the inferior area of the breast. So I will always use a breast drape during my sessions for this massage because of the angle of the camera. When I'm doing this technique video here, I will not use the breast drape so you can more clearly see what I'm doing. But I will always use a breast massage for all my clients when I do breast massage. And the goal is we need to cover the nipple and the areola at all times. So for the 30-minute session, we are going to start off with the neck sequence and the axilla sequence that you learned in whichever manual lymphatic drainage training you took. In order to help clients, you really need to be confident in your breast massage, in your manual lymphatic drainage massage. I'm not going to take time in this video to show you stroke for stroke. I am going to be confident that you are confident in your strokes and you just want to add on the information of what is going on for this client in order to customize your MLD that you already know to this particular client. So we're going to start off with the neck sequence, just the same as you would do the neck sequence for someone before a manual lymphatic drainage massage, and then we're going to do the axilla sequence. If you do take the arm up for the axilla sequence, know that your client is going to have more often than not restrictions in range of motion of the shoulder, so you're going to have to get the axilla from a narrower angle. Say that 3 times fast. So you're going to have to get to the axilla from the narrow opening of them not being able to fully do a range of motion. This is because often they may have some kind of surgery on the pectoralis major, either from taking the implant out and then trying to restitch or repair the pectoralis major from what was done to it when they had the implant put in, if they had the implant put under the muscle. So be super clear with the client on what their range of motion limitations are before you get them on the table. All of the massage for breast implants and explants can be done when the client is supine with the arms at the sides. We don't need to move them to move their shoulder area in order to give them a good massage. So we start with the neck sequence from MLD, the axilla sequence from MLD, and then I'll start doing a nice effleurage stroke. So I'll start from the sternum and kind of go over the clavicle laterally to the shoulder. This is just to do some gentle massage with the client, get them used to this kind of touch. And then I'll go ahead and do a little effleurage here from behind them. And then we can do some neck work. We can do some gentle neck massage with the client. We can do neck massage on the other side with the client, and we can do a whole neck massage that goes to the shoulders and maybe even the upper arms. Like I said in my other videos, this type of massage is to reduce the stress level. The client may be very apprehensive. They've been through a lot of surgery. This was a very upsetting process for them. And this will kind of calm them down. I love that point in the massage where the client just takes that deep breath. And you know they're ready for their body to truly get all the benefits of the massage. So after I do a little bit of effleurage on the neck and shoulders, kind of reduce some of that pain they may have from having to lie on their back after surgery, I start with manual lymphatic drainage on the breast area. And we can start from near the axilla, and we're doing stationary circles. And I'm doing stationary circles on the breast, and I'm pulling. My intention is to move the fluid from the breast to the axilla area. So first I'm doing it medial to lateral and superiorly, again with the breast drape, and then we can move the breast drape over, and I can do inferior to superior along the side of the breast area. And then depending on whether they had a mastopexy, a breast lift, you may see an incision here, a fresh incision here, an incision and a lollipop incision around the areola from the breast lift. And then this would be ideally covered with surgical tape at this point. And you can just very gently do manual lymphatic drainage over this area. And just the intention is to get the swelling out of the breast tissue and into the axilla. And then we can go ahead and go to the other side, replicate this. Again, in this short 30-minute session, the majority of what we're going to do after their explant surgery is going to be manual lymphatic drainage of the breast, moving that breast drape to get to the lateral side, and then doing inferior side of the breast, again up to the axilla. In the proliferative stage of healing, if you have 3 or 4 minutes after you've done that nice MLD session, you can see if you're addressing any adhesions. They may have adhesions if they just had an explant with just the explant and the capsulectomy taken out, and they may have some scarring here if they had the mastopexy, or scarring from the breast implant and explant surgery itself. And you can do a little bit of scar massage if they're in the proliferative and maturation phase, and you can do some massage that will just see if we can loosen up and get a little more movement in any of the adhesions that you may feel on the breast. So that is basically what I do in this quick 30-minute session. And then after, if we're doing any kind of deeper work to address the adhesions, any scar massage, we'll just finish up again with manual lymphatic drainage towards the axilla. And then I like to finish every massage with just some nice gentle effleurage if there's a few minutes left, to just give one last calming, peaceful strokes to the back of the neck. And then I tell the client your session is complete. Ask them how they feel, and then give them my recommendations on when they should come in for their next massage.